1 in 4 American adults has high LDL or bad cholesterol. Now, for the first time in years, the guidelines doctors use to evaluate and treat that, they've been overhauled, and a Cleveland Clinic cardiologist was part of it. Senior health correspondent Monica Robbins tells us this is now a lifelong conversation.
Dr. Leslie Cho is on the front lines of heart care and sees what high cholesterol can do. So she helps shape the new guidelines to fix the problem much earlier.
From childhood to young adulthood to middle life and to our senior years.
That means that the blood test goes beyond standard cholesterol numbers. Ask your provider to check your lipoprotein a at least once. Unlike LDL, you can't control this cholesterol.
Genetically determined. So it's not what you eat, it's not how much you exercise. And if you have high levels of that, it increases your risk for heart attack and stroke and for aortic stenosis.
A coronary artery calcium scan can help people who aren't sure whether they should start statins. The imaging test detects early plaque buildup in the heart's arteries.
You get a calcium score and it's 0. We're not going to start you on a cholesterol-lowering medicine.
The guidelines also say it's time to start checking kids between 9 and 11 years old. That's because 1 in 250 people carry an inherited disorder, usually found by middle age.
Called heterozygous FH. That's a genetic cholesterol defect. And it's not to start kids early on a statin. That's not what this is about. This is about identifying children with that genetic disorder so that we do diet and exercise early and aggressively.
People living with autoimmune diseases, kidney disease, or HIV are now considered high priority for earlier and more aggressive cholesterol treatment.
They actually die of heart disease. And so those are what we call risk-enhancing factors.
It's a new way of thinking about your numbers and catching cholesterol before it can do any damage. Monica Robbins, 3 News.
Monica, thank you. Now, there are a few other suggestions covered in the new guidelines, but the best advice, she says, is to talk to your provider about what you do still need to get checked.